5 Myths about CBT. Hi, I'm Paul Grantham, Consultant Clinical Psychologist and Director of the Skills Development Service. We've been training professionals in CBT for a number of years now and run one of the few CBT certificate courses approved by the British Psychological Society. In our training, we've been struck by the number of myths that people hold about CBT, and I wanted to expose the 5 most commonly held ones today. Myth number 1 is that CBT is directive, instructional, and top-down. I've personally never seen an experienced CBT therapist practice in such a way. I'm sure there must be some who do somewhere, but such people have clearly failed to read the Socratic questioning chapter in their CBT manual. Socratic questioning is central to CBT. It's about asking clients what they know about themselves, others, and the world, and how they know it. This is hardly top-down. Myth number 2 is that CBT isn't interested in deeper causes. It's all surface stuff. Now, although many clients improve with CBT by working solely with how they think about current events, rather than examining longer-term beliefs, CBT therapists will often work directly with clients' long-term negative beliefs, rather than just their present negative automatic thoughts. And part of this inevitably involves childhood historical events, in order to understand where these beliefs have come from. That's hardly all surface stuff. Myth number 3 is that CBT only works with clients who are cognitive. This implies that CBT only works with clients who are either unemotional or intellectual. But CBT is as much behavioral as cognitive. Exposure approaches for PTSD and phobias, and behavioral activation for depression are just 2 examples of CBT techniques which don't require the client to be especially cognitive. Secondly, CBT has long been adapted to working with non-verbal or cognitively limited clients, such as children and those with learning disabilities. Myth number 4 is that CBT is quick in, quick out. This myth has no basis in reality whatsoever. To be honest, CBT is not particularly quick in, quick out at all. The outcome research for CBT typically assumes 12 to 15 sessions on a weekly or fortnightly basis. This can represent the better part of a year's work and is typically longer than, for instance, work using brief solution-focused therapy, or, alternatively, many forms of counselling. CBT is more accurately described as a medium-term psychotherapeutic modality, not quick in, quick out. Myth number 5 is that CBT makes clients and practitioners fill in lots of paperwork. CBT likes to monitor client change as objectively as possible, and one way of doing this is through the use of questionnaires. However, the issue of lots of paperwork is not a product of CBT per se. Rather, it's either a product of funder-purchaser requirements, or alternatively, it's because the therapy is being conducted in a research context. CBT as an approach is no more supportive of lots of paperwork than any other psychotherapeutic modality. Hopefully this slideshow has exposed the 5 most common CBT myths, and that you'll be tempted to learn some more. Come and join us here at the Skills Development Service, www.skillsdevelopment.co.uk, and have a look at our CBT Introductory Certificate course, running in London, Manchester and Birmingham, or alternatively in-house within your own organisation. Drop me a line for further details at info@skillsdevelopment.co.uk. Thank you for your time.